Okay, we're going to do some trach care on Mrs. Smith. Before going to the patient's room, I'll make sure I look up her chart, make sure I have all the supplies that I need. I'm going to need a sterile suctioning kit, suction canister to the wall. We're going to need the trach care kit, also any PPE that I may need, probably a face mask because we can get some sputum in our face. We can get also some syringes of sterile saline and blue bag just in case for resuscitation. So upon entering, I'll knock on the door, ask for permission. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory care department. We're going to do some trach care today, okay? We'll clean you up. So we always want to make sure we communicate with our nurses. Trach care needs to be done at least twice a day. And we'll go ahead and get started. I'm going to lay the patient back. We'll start off making sure I hook up all the suctioning to the wall, and we'll do the sterile suctioning. After we do sterile suctioning to the patient, first make sure I will check her vitals and breath sounds and everything and make sure she's breathing okay. Then we'll go ahead and check the cuff pressure as well. We want it to be in between 20 and 30 centimeters of H2O. And then we'll go ahead and, using a sterile technique, suction the patient. Making sure I have a clean hand and a sterile hand, only touching the catheter with my sterile hand. I'll hyperoxygenate the patient, take that off, go ahead and insert the catheter, suction, occluding the thumb hole, and pull out. And then we can go ahead and oxygenate the patient again. Now that we suctioned her out, we can open up our trach care here, and we want this to be as sterile as possible. It's an aseptic technique that we do use. So we'll go ahead and put that on, take this off here, and we'll untie the trach collar. We can go ahead and take out the inner cannula, making sure to hold down the trach itself. If it's a disposable one, we can just toss it. If it's not, we have stuff in our trach. We got these little pipettes. There's a basin. We put in some saline and we can clean it. Now we'll go ahead and take out this gauze. And in our other basin, we have Q-tips, and we'll make sure we have some saline on there, and we'll clean going from inward and out, tossing after each swipe, inward and out, tossing using a new Q-tip with each swipe. We're going to inspect the stoma to make sure that it's not oozing, any redness, swollen, foul odor, anything like that. So then we'll go ahead and make sure it air dries, and then we'll put the new cotton in, gauze, make sure that fits securely. We'll go ahead and tie a new necktie on there, and I have a new inner cannula that we'll go ahead and insert, securing it. We always make sure with our trach patients that we have a couple spares in the room with them. One that's going to be a size smaller just in case there's any swelling or change in the anatomy to the patient. So we have that ready to go. So we'll go ahead and clean up everything here, put it away, set Mrs. Smith up, make sure to ask the patient, assess the patient, SpO2, breath sounds, and that the patient is comfortable and breathing, and then make sure she has her collate, and then we're all done.